Hey, everybody. We are here this morning after a bit of technical difficulties, which I do not have to tell you how that is. My name is Tippy Felsenstein, and I am here today with Lee Tomlinson, who is the author of the book Compassion Heals Self Care to Healthcare. And basically, as a patient, Lee Tomlinson is now dedicated to compassionate care, and he's on a crusade and on a mission to restore compassion to healthcare and to healthcare professional and to the world at large. Which, if you have ever been in the hospital, which I have been, it seems right now like it is mission impossible. Although I think if anybody can do it, Lee Tomlinson can do it, because Lee Tomlinson has had what we would call a very successful life, where a very small percentage of our population gets to do all those things. He was an international businessman, a marketing genius, standing behind the American Film Institute for 10 years and 100 greatest movies, movie specials on CBS, which is a multi-million dollar fundraising campaign included. He was a major Hollywood film studio owner, and of course, a loving husband and a near scratch golfer. One day, he found himself in a hospital with cancer, and now he was a patient. The harsh reality of how patients are treated in the hospital hit him. And I have to tell you guys, if you have not been in a hospital, you have no idea what goes on in the hospital. Unfortunately for me, I was in near fatal accident, and I was at the mercy of the staff in the hospital. So I know exactly what you're talking about when you say that. But that is such a huge mission. I mean, when I got out of the hospital and realized what was going on, my reaction, and I think most people's reaction, would be to run as far away from the hospital. And for me, I did everything the doctors told me to do. I did the opposite, because I figured if they're going to treat me like this, if I do the opposite, I'll probably survive, which worked for me. But to take on a mission like that, Lee, I I so admire you. You are definitely of the 20%, maybe even 10%, or maybe 5% of the people would even dare. So first of all, welcome to TP Talk. I'm so glad that you decided to join us, Lee.
Well, Tips, it's good to be here. And like you, given my medical history, it's good to be anywhere, actually. Every day above ground is a very good day.
And you really appreciate it after you've been through the mill.
I have, well, let's be clear. I've had a life full of hospitalizations. I have an addiction to adrenaline. So I've been hospitalized in 6 different countries, broken over a dozen bones, had my thumb pulled off, had skin grafts, bone grafts, more infections and diseases than I can even remember. So I've been in and out of the hospital a lot in my lifetime. And frankly, I'm still alive because of the competency and compassion of my medical experts around the world, until I got cancer and then found myself in the hospital at the very end of my treatment, when I was as miserable and in as great a pain as you could remotely imagine, being treated for advanced throat cancer. And when I was in that hospital, I was treated like a piece of meat. I was the aging white male in 2212. And literally, it was like I didn't exist. I got no kindness, no caring, no compassion, no humanity whatsoever. And since I had put my life in their hands, if they thought I wasn't worth simple human kindness, I figured I must be not worth living and decided to end my life. And I would have done that if it hadn't been for an incredibly kind, caring, and loving interaction the day after I got out of the hospital with a doctor friend of mine who came to visit, who heard my story from the hospital, literally started to weep, put his hand on my arm and deeply apologized for the compassion he said I had not received while I was in that hospital. And he said, you know, Lee, it's getting worse. He said, 50% of Americans today get zero compassion, and it's absolutely critical to the best outcomes. He said, rather than doing yourself in, how about this? How about you fight and live? And if you're successful and you get through this cancer, he said, how about you spend your life trying to remind healthcare professionals of the absolute necessity of providing their patients with compassion and the equally important necessity of providing themselves with compassion so that when they deal with us patients, they're healthy enough to give it to us. And that's what I've been doing, because I don't want anybody in the world to experience what I experienced in that hospital at my lowest point.
And so you took to the road, you put on a hospital gown,
Yes,
and
yes.
you do a presentation, which it has to be humor, compassion, urgency, encouragement, call to action. So now you actually have become an actor on a stage.
Well, it's so, yes, when I first began this mission, and you understand, I was at the end of a grueling, extraordinarily excruciating treatment for cancer, then the infection, which is what I was hospitalized for. I had to learn how, I was so damaged by the radiation to my throat. I had to learn to swallow and speak again.
Wow.
So this doctor friend said, well, start a movement. Well, that sounded like a good idea, but I'd never started the movement. So what I started to do, I was very lucky, was I started to be invited to address groups of medical professionals, doctors, nurses, administrators, you name it. And so since then, which is about 6 years ago, I've done over 200 keynotes. I've been honored to address over 200 audiences around the world. And I figured one way to get their attention, since I'm not a doctor, I'm not a nurse, I'm a perpetual patient, is to walk out in a hospital gown and feel and give the feeling to those people in the audience. When we start with you, the moment we're in your presence, we're already in pain because we have to wear this horrible gown with our butts sticking out. We're humiliated. And that's how we start. And it gets their attention, and it absolutely serves the purpose. So again, I've been 200 stages with this gown. I hate it. It's embarrassing every time, but it works.
I think it's a brilliant idea. I would have never thought of it because with that gown, and you know, they talk about putting on a costume in Hollywood. With that gown, you don't even have to say a word.
Right.
Maybe you have to kind of make a turn around and show them the back as well to make such a powerful statement. So
well, it's funny you'd suggest that, because what I do is, what I realized after doing it a few times is that everybody in the audience is going, first of all, whoa, this guy is really a patient. Whoa, he's in a hospital gown. They can see that I don't have long pants on. So their question is, is he wearing boxers, briefs, or nothing at all? So I start the conversation when I walk out by saying, all right, raise your hand if you think I'm wearing boxers. People raise their hand. Raise your hand if you think I'm wearing briefs. Raise your hand. And then it's, okay, a lot of you didn't raise your hand. Does that mean you think maybe I'm going commando here? And everybody raises their hand. And I said, well, here's the bad news. In the course of our conversation today, you're going to find out, because that's the crummy part about these gowns. Again, when we're in your presence, we're always afraid and embarrassed to show you our butt. So you're going to see it. You're going to figure it out by the very end. Don't worry.
I would be wondering if you had just escaped from some kind of mental hospital or...
Well, I got to be honest with you, even though I've done a couple of hundred keynotes around the world, I sometimes wonder if I escaped from a mental institution. But then I remember my cancer journey and all my others. No, I'm a little crazy, but I'm not nuts.
No, okay, maybe not a mental institute, maybe just a hospital. Look,
Yes,
I
yes,
stayed with your
yes.
hospital. I escaped, and let me tell you, when I was lying in that hospital, I cannot tell you how many times I felt like just walking out. I
Me
didn't care
too.
about the gown
Me.
or anything.
Yeah.
So, but it's not about me, the story. So and I can give you a lot of examples of things that happen in the hospital that would make you cry. But give me one example of something that really got to you when you were in that situation.
In a positive or a negative sense?
You decide. No, well,
Well,
let's start with
well,
negative.
in the hospital, I mean, so there was I had a heat problem in my room. My thermostat didn't work. So I asked the nurse, could you please turn down the thermostat? And she said, well, I don't know how to do that. You have to call maintenance. Okay, so now I have 104 temperature. I have a life-threatening infection. I'm dying of cancer. Okay, I got to call I got to call maintenance. I get the guy on the phone. I said, sir, please come fix my thermostat. I am sweating profusely. I've got a fever and cancer and an infection, and I am so damn hot. I am absolutely miserable. And he says, sir, until you stop swearing at me, I'm going to hang up. And when you get control of yourself, call me back. What? I'm paying you $10,500 a day. I use the word damn, and that is so repulsive to you that you can't manage to get past that for a patient who's dying in your hospital and paying you $10,000 a day? It was infuriating. There was the housekeeping woman that would come in every day for 10 days, clean my room, never once spoke to me, never introduced herself, just walked in and started working. I mean, I felt like I was invisible. There was when I was first admitted and got to my room, and it was very hard for me to walk. I got up, managed to make it into the bathroom, and found a foot-long black hair on the tile in the shower.
Oh my God.
I mean, I could go on for an hour. I have 100 stories
I
like
was just
that.
going to say, I asked you for one example, and I'm sure you have 1,000. But the staff, and I have to say before we talk about the staff and the nurses and the doctors, that there are some nurses and doctors. I don't know if it's 20% of them or 1%. I have had the very rare occasion when there was a good, compassionate doctor that acts the way a doctor should. I have like your friend,
Yes.
but not the majority. The majority of
Well,
them are really Dr. Frankenstein.
well, I'm fortunate to have not had that many experiences like that. This hospital it was so astounding to me because through my whole lifetime, everybody that I met was, whether it's doctors or nurses or accounts receivable, were all incredibly kind, caring, and thoughtful. So this was just shocking to me. And that's why it had such a negative impact, is because I was at the very end of my rope physically, mentally, emotionally, spiritually, financially, romantically, and I'm dying, and now they treat me like this. So let me make it very clear. I love my doctors, nurses, and everybody else. They have saved my life on more occasions than I can remember. It was just in this hospital, it was a confluence of a lot of different factors. And what I learned since is this. My first reaction was, I got to get these people out of healthcare. I don't want them to do this to anybody else. They're all horrible people. No, they're not. They're actually, the majority of them, incredibly loving, kind, compassionate, thoughtful people. But the 60% of them at any given moment, it's much higher now with COVID, are burned out because they give too much and they don't take care of themselves. All they want to do is take care of everybody else, and they let themselves get into a box and burn out, and they're miserable. And when you're miserable and you're burned out, you are unable to be compassionate. So when my book says compassion heals from self-care to healthcare, my message to all of those healthcare professionals and human beings is take care of yourself first. Make sure you're healthy. If you want to give us the compassion we absolutely need for the best outcome, You must be very clear that what your hurt is, what your pain is, and never take it out on your patients. Simple.
Well,
Not easy, but
well,
simple.
and it's not just that it's not easy, because I've spent a lot of time in the hospital the last few years. My mother was very sick. They're
Mine
getting
too.
they're getting now to the point where they actually would assign one nurse to such a vast amount of patients that are literally
Correct.
dying, that
Correct.
no matter how much they try to take care of themselves and no matter how great they are as a person, it's virtually impossible to be in 10 places at one time. And I'm saying 10, and
I
I'm
agree.
generous with 10. I think it's even more than that. And that's just the nurses, and the doctors are getting way more patients that they can have, especially in ER. So even if you take the nicest person in the world who has to deal with that every day over and over again, a thankless job, it's going to give on the patients. The patients are going to suffer.
Well, we're both suffering. All of us are suffering. And however, when you're in healthcare, your job is to treat, cure, and comfort your patients according to Hippocrates, the Hippocratic Oath. And so treating and curing, that's an intellectual experience. Comforting is different. Comfort is not what you do to someone, it's how you do what you do. And it comes from the Latin word to strengthen greatly. Comfortare is the Latin word for comfort, treat, cure, and comfort. It means providing emotional support, strength and hope, consolation in times of loss, and encouragement in difficult circumstances. So, in order to be able, and that just takes a minute. I mean, my conversation with that doctor took all of 3 minutes, maybe 5. So, it's not about length of time, it's about being fully present. And if your burnout rate is 60%, you can't be present. So, there's 2 reasons for that high number of burnout. One is, healthcare workers are lovers, they're givers, they put themselves last. Not a good practice. Secondly, is the institutions in which they work don't value their self-care enough to support it. So the institutions they work in need to create a compassionate environment for their people to work in so they can stay healthy enough to be able to be competent and equally compassionate when they treat us. That's a big problem. That's why I'm alive. That's why I do what I do, is to speak to those healthcare professionals. If it's just you, fine, take care of yourself. It's a necessity, not a luxury, and it's not selfish. And if you're an administrator, you must create a compassionate environment for your people to work in, or your patients and your staff will equally suffer, and in sometimes the loss of life.
I have to say, you're very brave to take that on, but somebody's got to do it. So I guess you're the right person to do it, but it's a huge mission. And like I said, I'll say it again, it seems like mission impossible, but probably you're the only one that could do it. So I really
Well,
appreciate what you're doing.
thank you. I don't want anybody to experience what I did. I don't want the healthcare workers who are so brave to do who wants to be a nurse or a doctor? I mean, give me a break. And you're in a hospital and people are dying and pain. And so, I mean, do that every day. So I am extraordinarily grateful for them doing that. And I just simply want to do it as a way to say thank you, to make sure that they are healthier and we patients are healthier, because compassion is present for both of us.
Yeah, I definitely would not want to do it. But since you brought up COVID, what's your personal opinion on how that's handled right now? Have you been exposed to what's going on in the hospitals? How do you think,
Yes.
what do you think the medical profession is handling it?
Well, I got to tell you, before COVID, the medical profession was ridiculously difficult. I couldn't do it. You couldn't do it. The vast majority of us couldn't do it. That kind of pressure every single day, every single interaction. If you make a mistake, it costs a life or damages someone, injures somebody. That's a heck of a lot of pressure, every single patient. So it's really, how do I say it? It really is an awakening moment. It's infinitely worse now because COVID put an extra stress. And with masks on, it's harder to communicate in a compassionate way. You're not supposed to touch, you've got gloves. It's very difficult with COVID for healthcare workers to have been as compassionate as they normally are. And then when you look at the caseload, 60% is low. It's probably 80+% now of healthcare workers who are burned out. So if ever there was a profession where they need our compassion, yes, we need it from them, but they also need it from us. They need to know that we appreciate that they're going the extra mile. They're putting their lives on the line in order to help us save ours. That's brave stuff. That sounds kind of like a Marine or a soldier. They put their lives on the line to help save ours. They're my heroes. Are they perfect? No. Am I? No. We can all get better. My job is not to make them do anything. It's to deeply express my appreciation for the work they do and hopefully remind and inspire them that compassion for their patients is critical to their recovery, COVID or otherwise, and so is their own health. So both of those are equally important. And if they're not healthy, they can't help us. If they had COVID, would they go to the hospital and work? No. Well, if they're burned out and they can't be compassionate, which is a critical element of our treatment, they shouldn't be working either. Or they need to solve or cure that pain they're feeling so that they can be alert, be attentive, and be compassionate. That's my job, is to remind them of that and hopefully inspire them to do it.
So you just made me realize something, that
What's
it's
that?
really not the doctors and the nurses that are the big problem. It's the system that they work under. I know that every time a company hires a person, they give them a training where they teach them corporate policies, how to relate to different things. The corporation sets the mode on how the employees treat the public. And in
Correct.
this setting, it's the doctors and the nurses that the training that they get on how to treat patients is less than nothing. And that's probably what the problem is. It's the system, it's not the individual. You just made me realize that, because being in the hospital,
Yep.
also your experience is different if you're in the hospital on a private insurance or on a medical, government medical insurance. It's still different treatments, and you get a little bit different staff and a little bit different attitudes. But overall, you could be a billionaire and be in a private room. You're still going to have to hire your own advocates and your own nurses if you really want the hospital to relate to you. But so I think I'm getting clearer. Your mission here, your message is to the staff, not to the patients.
Correct. Absolutely correct. Although I do speak to patients, what they call cancer survivor groups, celebrations of life. But you're absolutely right. My message is to those healthcare professionals who are suffering in their workplace, and in their suffering, leaving themselves vulnerable to burnout, at which point they can't be both competent and compassionate. When they're burned out, they make more medical errors and they're unable to be compassionate. How would you like to be treated by somebody like that? And the institution in which they work doesn't help them solve those two problems.
Right.
There needs to be a commitment by that organization to say, we need you to stay healthy so you can help our patients get healthy. What do we need to do that? Is it dietary? Is it exercise? Is it rest? Is it relaxation? Is it time off? Is it less out? Whatever it is. Too many institutions these days are valuing money more than human life. That's not okay. We have to realize that people in the healthcare industry are dealing with the injured, dying, and their families, and have to be, again, competent, that's why you get certified, and compassionate. And it needs to be a corporate value that is measured, that is trained, that is reminded every single day. And that's what I'm advocating for. And I think we're making progress.
Yeah, you think that we're actually making progress? That it's
I
going
do. I do. I do. And you know what? All I can do is impact one person at a time, and then they impact. It's the same way with when you're kind with someone, it's statistically proven that they're likely to pass it along. So doing a simple kind act to someone will have a lot of impact moving forward. So all the best I can do is if I speak to 1,000 people in an audience at a healthcare conference, some of those people will go, wow, I am burned out. I need to take better care of myself. Some will say, wow, my department, we don't take very good care of our staff. I need to be more compassionate with them. Some of them will say, yeah, this guy's nuts. All right, those people go with God. The rest of them, though, is they can make a difference with their patients, themselves, their colleagues, and their institution as soon as they get back in touch with that loving human being that they were when they first got into medicine. That's my job, is to reconnect them with the human that began their career, that was kind, caring, and loving, and healthy, and able to be kind, caring, and compassionate.
wow, powerful, very powerful. So
Thank you.
I told you before that my answer was dramatically different than yours by totally distrusting everything that the doctors and nurses told me to do. Some of them were very kind, but when I got to the point, when you get treated that way, you kind of feel, okay, these people are treating me so badly. How can I trust anything they say?
I agree.
So obviously, when they came out with the COVID protocol, my instinct was, yeah, right, not doing anything they say. How do you feel about the protocol of what they want us to do and how they
Yes.
said? Are you wearing a mask? Did they tell you that you should be injected and take the vaccine? Have you taken it? Like,
I have taken it. And look, I'm alive today because of doctors and nurses.
yeah, me too. I mean, I'm not undermining. They saved my life.
Yeah.
When your car crashes and every bone in your body is broken, without the doctors, I would either
Yep.
I would definitely be dead. So I'm not I'm not undermining that at all.
Okay, well, so the answer is, and I deal with hundreds and thousands of doctors and nurses and experts and scientists every single day, is I believe them implicitly. Are they perfect? No. Is their data perfect? No. However, the infinite amount of data that I have read about COVID, honestly, to say it bluntly, not getting those shots, if you don't want to get the shots as a patient, if you don't want to get them, that's fine. But remember one thing, COVID is real. If you don't get the shots and you get it, you're not going to necessarily even know that, which means you're going to spread it to other people who haven't gotten shots, which means that your unwillingness to get a shot puts other people's lives in danger. That is unacceptable. So my experience is that, or my opinion is, based on the facts of science, that COVID is absolutely necessary for the health of this country and the people of the world. If we don't do it, we will continue to spread it and lives will be lost. We've already lost in America alone 600,000 people dead because of COVID. Had they been inoculated, the vast majority of those people would be alive today. So I don't want to see anybody else lose their lives, particularly as the result of someone who decides they're not going to get 1 or 2 shots. What could it hurt?
So do you
Absolutely nothing.
So do you think it's okay what they're proposing now to go door to door and basically coerce people into getting it?
I have heard nothing about coercing people. You cannot coerce people to take medicine. There is no law that demands that. So I don't know what coercing
No, but
means in that.
the proposal is to go door to door from it to. I'm not sure what they're going to do when they get to your door. They haven't done it yet, but they will go door to door to check on people if they have a symptom.
Well, here's the thing. There are many people in underserved communities in America today that don't have the information on where to go, haven't the means to get there, may have aging issues which affect them cognitively. So if someone were to, if before I got my shots, if someone had said, we're going to show up at your door between 9 and noon, if you're at home, we'll give you your shot, I'd have been thrilled. Coerced, I cannot remotely imagine. Offer is different than coercing.
Well,
I don't think we should force people to do anything medically.
Right. It depends what you call coercing. I mean, people have been told in many countries that they can't go back to work if they haven't gotten the shot. That's kind of a form. Or they can't go to the gym, or they can't fly, or they can't
Yes,
do much of anything. Even
I think that's reasonable. If you have a
that's
disease,
what I meant by coercion.
yeah, I beg your pardon. I thought you meant threaten them with
I don't mean come in with a gun,
legal.
the gun
Okay.
at your head. But if you can't eat, there's not much else you really can do. If you can't buy food, if you can't
Well,
fly, like right now,
there's ways to get. You can wear a mask.
No, I'm saying if that's the choice, like for example, in Israel right now, you cannot walk into a gym if you have not been vaccinated. You cannot walk.
Good.
You cannot go into many institutions. A lot of people were told they cannot go to work unless they get the vaccine. So,
Good.
That's coercion, isn't it?
No, that is simple safety. You know, look, you can't come to work with a gun. You can't come to work in your underwear. You can't come to work if you're ragingly angry. You'll be asked to leave. So there are lots of things that are standards in workplaces to ensure the safety of those people who are working there. And I think that given that we have amongst us a disease that's cost, forget the people who've been sick and suffered, well over 500,000 people in the United States alone. This thing is deadly. And the more that people spread it, the more likely there will be a variant, which will infect all of us again. And we will go through this again and lose another 600,000. I think that it's perfectly reasonable that if someone decides that they don't want to get the shots, they have to know there's consequences to that. And do I think it's reasonable to keep your colleagues safe because you decide you don't want to get a shot for a disease that's very real and fatal? Absolutely. When you make decisions, consequences follow of any kind. You decide to speed, you get a ticket, you crash, you kill somebody, it's not okay.
Or you have
That's
to show up in
against the
traffic
law.
court.
If what?
Or you
If
have
what?
to show up in traffic court and deal with it that way.
Well, which you had a very difficult time doing for that ticket, because of the technology, for God's sakes.
Right.
But I don't find it unreasonable. It's fine. Just know your actions have responsibility around it. And when you decide you're going to not get a shot, you stand the likelihood of catching a disease which can infect and kill others. I think it's not unreasonable to say you either must wear a mask or you must get inoculated. I don't find that unreasonable at all. I find that incredibly smart.
I don't want to go into a COVID discussion, but that's not the choice. It's not a choice about wearing a mask or not going. It's a choice of getting a vaccine or not going. A mask is not a choice in most places. Not here right now. I don't know if it's in the United States, but in other countries. So it's a little bit different.
Again, I believe that people should get shots for the safety of all of us. And if you decide not to do that, that's fine. Just know that you're going to have restrictions so that you can't infect the rest of us. That to me is reasonable.
Yes, you won't be able to buy food. You won't be able to go to work. You won't be able to go to the gym. You won't be able to fly anywhere. Basically, you'll stay home and die of starvation. That's consequences, all right. But like I
Well,
said,
there's
I don't
plenty
want,
of ways. There's
I don't
plenty
want
of ways to have food delivered. That's not a consequence. There's plenty of ways. All you got to do is call it in, and they'll hand deliver it to you.
in the United States, but in other countries it's different
I
because
can't speak for other
yeah,
countries.
but you know what? I really do not want to go into a discussion about COVID because your book is really important, and I want people to understand and to read it. It's a fun book, and I think you're doing something great. And COVID
Thank
is
you.
definitely kind of related because it's also health related, but it's not what your mission is right now. Your mission right now
Correct.
is to make people aware of what's going on and to maybe change the system a little bit, which will save
Yes.
thousands of lives.
Yes.
And it's even more than that. Being a patient in a hospital and being treated less than human, actually treated worse than animals because dogs are not treated that way,
Yep.
is such an important, huge thing. I spent 2020 in the hospital a lot with my mother, in and out. She passed
Yep.
away in October 2020, so I spent the entire year with the medical, and we had amazing doctors that came to the house to treat her. We had
Wow.
amazing nurses. She couldn't go, and so yeah, which was amazing. But we also had some very, very disturbing things happen in the hospital setting. And honestly, she would have been
Sorry.
so abused if I was not by her side. Like if you
Yes.
had somebody by your side calling housekeeping for you, then your experience would have been different. And that's what I had to do for her that she couldn't do for herself. Not everybody is able to do what you did, pick up the phone and call. If they're so weak, they can't even make a phone call.
I agree. I agree.
So
Having someone by your side when you're going through a significant illness or injury
amazing.
is a gift from God. Because first of all, I'm in the hospital. I'm going to complain while I'm in the hospital about how bad the care is. That's crazy.
Not
It's going
gonna
to get
help you much.
worse.
Yeah.
People are going to punish me for
Yeah.
speaking up,
And
or
you
that's my fear. That's my fear.
no, but you will be
Um,
punished because why would I want to come and help you if you're gonna complain about me?
right,
I'm gonna
right.
feel, yeah, I might as well go to the other patient who says nothing and I can do what I want. That
Yeah,
definitely is there. Me advocating for my mother got me to the point where I almost got kicked out of 2 hospitals because I demanded that they feed her. They wouldn't give her food. That's just a basic human need.
right.
But if I wasn't there and she wasn't able to talk to herself, she lost 20 pounds. She came out of the hospital weighing 80 pounds with me advocating. Imagine if I wasn't there, what would have
Not
happened?
a chance. She wouldn't have survived. I lost 60 pounds. I get it. I mean,
Got it.
listen,
Yeah.
hospitals are not a place you go for fun.
You don't
Yeah,
even go to hospitals to heal. I mean, that's what they're supposed to be. But like, look, when I needed stitches, nobody else could have saved my life and gave me stitches. When every bone in my body was broken, they scooped me out of the gutter and took me to the hospital. Of course, they're necessary, but what you're doing, not only making people aware of how patients are treated, and people that have never dealt with hospitals, they don't have a clue. They just think it's a hospital. You really do wake up when you're in there by yourself trying to really survive.
yes. And it's not just hospitals, it's also private practices. It's anywhere you go for medical treatment. If you're not being treated with respect, humanity, kindness, caring, consideration, it literally damages your immune system mentally, physically, and emotionally, and spiritually, and can mean the difference between life and death. So it is unacceptable for any reason. We can look at the reasons of burnout or institutions or whatever. But when you
Not
put your
acceptable.
life into people's hands, you expect to get the best possible everything. And that is both treatment and care. And when you don't get that, that is a catastrophe for the patient and their families. So I'm simply advocating for healthcare professionals to wake up to the fact that the majority of them are burned out and that they're not being the kind, caring, and compassionate human being that they were when they got into medicine because they're burned out. So they need to look at their own health, take care of themselves better, and recover or come back to that wonderful human being that started on day one at that hospital. That's my goal. It's achievable. It takes work, it takes change, it takes commitment, but it's an absolute imperative if what they want is the best outcomes for their patients when they enter into their care. I know they want that, but there are conditions that prevent it. That's what I'm trying to change. Self-care, what? Compassion heals from self-care to healthcare. If you take care of yourself, you will be able to give caring health care. That's my goal.
Right.
That's the name of the book.
Right.
Huh.
That's what I was going to say. Your call to action is compassion heals. And I think it's also a brilliant connection that you connected the name of the book, the title of your book, Compassion Heals. It's a title, but it says everything. That's your call to action. That's everything that
Yes.
you want to really say. And also from self-care to healthcare, such a cute slogan. I mean,
Thank you.
I always wonder how people come up with that. And I kind of expect for you to say, well, one day I was just sitting looking at the sky and a white light appeared in front of me and told me compassion heals. Yeah.
I got to tell you something. It was kind of like that. No
Really?
joke. No
No.
joke. Oh, I got to tell you something. First of all, writing a book about my cancer experience, good, bad, and ugly, was on one hand excruciatingly painful to relive those memories. On the other hand, it was very freeing. It helped me release all of that rage and anger at God and the universe and the medical professionals. I mean, I when I was clear I wasn't going to die, all I was angry. So, I mean, it's, being that sick is a full-time job, mentally, physically, emotionally, spiritually. And, it's very hard to get through it without healthcare professionals who are on the same page. So, who knew if I could make a difference, but I was going to try. And so far, it's going very well. But literally, we tried to figure out a title for that book for months and months. Played with words and sentences and short and long and all, literally, no joke. One day we said, this book is about compassion and its healing power. Compassion heals. Okay, that's interesting. But what does it take to do that? Well, you got to take care of yourself before you can give health care. Compassion heals from self-care to health care. It literally was just like that. And after months and months, it just came to us. So I think that both my work, that doctor showing up when he showed up to encourage me and express his sorrow for the experience I had and, suggest that I use my skills to try and change it. I think that was all a gift from heaven. And I am thrilled to be doing what I've had. A great career, a great life. I've done pretty much everything I ever wanted to do, but this is the best work I've ever had. I could not feel more loving kindness towards healthcare professionals than ever. So it's been a joy doing what I'm doing, and I love it. I just want to figure out more ways to do it, hence the book. And we're working on a documentary film. I want to get this message out about self-care to healthcare to every man, woman, and child on the face of the planet, particularly healthcare workers. Well, there's 22 million in America alone, and there's 50 million around the world. The only way I'm going to reach them with this message is with a documentary. So I'm putting together corporate sponsors, which is what we did with the AFI TV shows, to fund it, shoot it, and distribute it worldwide to every healthcare professional on the face of the planet, showing the scientific proof of the enormous healing powers of compassion for the receiver, for the giver, and for the bottom line of the institutions in which their lives interact. So that's what I'm up to. And, the book, the keynote speeches, and the documentary is helping us reach that audience. And it's a joy to do it.
It sounds to me like your project that you're doing right now, is the silver lining of
Yes.
the
Yes.
the disease that you got, and it might even be the reason why you got it to put you on that path. If you didn't get sick, if you didn't end up in the hospital, would you have been
Yes.
doing this? You wouldn't
No,
have.
no,
So,
there's no way in the world.
right.
It is the universe saying, okay, enough of this entertainment stuff. You can do that on the side. Enough with the Hollywood, enough with fame and fortune and all of that. We're going to take all of that away. And we're going to somehow give you some clues that say, you need to do what you can do to change healthcare for the better. You know what it's like. You're not talking scientifically, you're talking experientially and scientifically. So if there ever was a person to talk about the positive benefits of compassion and the negative ones when it's not around, it's me. And I would never, ever, ever have had that experience if I hadn't had cancer. So I do believe that probably I'd had a lot of less strenuous messages towards that end in my lifetime and ignored them. And the universe said, okay, we're going to give you something because you said you wanted to grow in this lifetime. So we're going to wake you up with this cancer thing and show you what your life purpose is. It did. I did. And I am blessed to be following it 110% now. So I don't recommend cancer for anybody. Anybody. It's horrible. Worst experience of my lifetime by a million miles. However, it did open my eyes to a situation that maybe, just maybe, I can make a difference in. And that is why I'm alive today.
And compassion is one of the most powerful forces in the universe, that if you tap into that, you're tapping into a lot of power to heal, to make the world a better place. So before we
No
run out of
question.
time, if somebody
Oh,
wants to get your book, where do they get it? And if they want to get a hold
yeah.
of it, how do they get a hold of it?
Well, very simple. To get a book, just go to Amazon.com. I mean, that's the easiest, quickest way.
Right.
Go to Amazon. It's on Amazon.
Right.
If you'd like to get a hold of me, if you'd like to have me come speak to your medical organization or conference or whatever it is to deliver a keynote, simply, here's my email address. Just reach out to Lee, Lee, at Lee, Lee, Tomlinson, TOMLINSON.com. That's Lee at LeeTomlinson.com. And let's talk about it. Let's see how I can help. I'm delighted to do it and alive and around to be able to do it. So let me help.
And thank you so much for doing it. We definitely appreciate it, and we appreciate you putting so much energy, and it looks to me like you're doing it with a lot of joy. So that's even
Yes.
more appreciated. The more you're doing it in a very compassionate way yourself. So basically you
I
set,
hope so.
but it seems that way by the way you're talking. So you're setting the
Thank you.
example of what you're asking for others to do, which is very
Yes.
important. Like don't do as I say, do as I do, makes it so much more powerful.
I couldn't agree more. And listen, let's be very clear. You know, I'm not Mahatma Gandhi. I'm
No,
not Sister Teresa. You know, but I'm doing the best I can. I'm not perfect by a million miles. Do I have moments when I'm uncompassionate? Absolutely. Less than ever, but sure, I still have them. But again, it's simply trying to say to people, look, you want to feel better, happier in life? Be kind. You want to see other people happier? Be kind. It's that simple. We give a challenge in my talks called the Compassion Heals Challenge. And here's what it is. Don't just talk about it. You want to change the world? Commit to doing something. Commit to consciously, intentionally giving one single kind act per day for the next week. 7 kind acts. That's it. Do that. That will have a ripple effect. But you can't just sit around and piss and moan, oh, the world's this and the world sucks. I mean, everything sucks. You can either sit and complain or you can do something. And if you wonder whether or not you have the power to actually do something that can make a difference, let me end with a quick story. There's a fellow who wrote a suicide note. I can relate to that. Wrote a suicide note and said, I'm going to walk to the bridge and I'm going to jump off unless I make eye contact with one single person. They found him floating in the San Francisco Bay. He walked all the way to the bridge and never made eye contact with one single human being. If one person had glanced in his direction and given him a smile or simply a nod, he'd be alive today. So if you think that a simple, kind act doesn't make any difference, you're wrong. It may not save a life every single time, but it will absolutely improve the health, mental, physical, and emotional health of that person in that moment, and maybe for moments or years to come. So 7 days, 7 kind acts. Do something to relieve the suffering in the world by being kind to friends, neighbors, strangers, or yourself. You choose.
Absolutely. And it could be something really, really small. I'll give you an example of something that happened to me yesterday, which does not happen very often. I was walking on the sand and my feet were all sandy and I wanted to get into my car. So I'm looking for a place to rinse it off. So some random person was standing there. And I said, excuse me, do you know where I can get water to rinse my feet? The guy literally walked to his car, brought out a big bottle of drinking water that he probably was saving for himself and said,
Wow.
use my water, which I did.
Wow.
Uh,
Wow.
and then
Wow.
and then I said to him, that's amazing. I definitely did not expect that. And you must be very special. The guy literally had tears in his eyes. He goes, please give me a hug. It was just
Oh,
it was such
I'm
a
in love.
surreal experience. And it does not happen very often. And I think I smiled and I asked him very kindly if he knew where I can get water. Um, and it triggered something. You never know.
Well,
I don't know what he's been through.
I promise you, he has pain too. Those tears and that need for a hug, that's his pain. He's not feeling connected. He's not feeling, that bond that we are
Humanity
genetically
to another
formed to have. Exactly. And here you are trying to wash your feet, and he's giving you distilled water from
he's
a jug.
drinking water. God, yeah.
I mean, that's the literal definition of compassion. And look at how he felt when he gave it to you and you expressed your gratitude. Look at how you felt, and look at how your feet felt. They felt clean.
My feet
So
were
that's
happy. My feet were very,
that's
very happy and clean.
well, and now you've told that story to me, which inspires me, and your listeners will hear that story and they'll be inspired to take action. That's what compassion does. Both of you were buoyed by the interaction. Now it's rippling out. I'm inspired by your interaction. Your listeners are inspired. They'll put more kind acts out there. So let's start a movement. Let's start a Compassion Heals movement. And let's individually say, I'm committing to making the world a better place. If I see anybody who needs their feet washed, I'm going to get them some water. Or
feet washing campaign.
everybody's in pain. So if you walk around, you're going to see people. That homeless guy, give him $1 for God's sake. It's $1. Give him $1. It'll make his
or give him 50 cents. Give him something.
Or give them half your sandwich, or help a person open the door. That simple connection, which says, I see you, I feel you, I feel your pain. Let me help just a little bit. Absolutely has measurable, scientifically healing benefits for both. That's the power of compassion. It's not made up. It's not wishy-washy. It is scientifically proved. We can change lives and sometimes save them, like that fellow walking to the bridge, by a simple, tiny, kind act. That's a blessing. When my mother was in the hospital and she was on her final legs, definitely in hospice, there was an opportunity for surgery, and I had to make the decision immediately. Do I give her surgery or do I not? I just wanted to make that decision. I was standing in the hallway trying to figure out what the heck to do. A nurse walked past me, turned around, came back and said, would you mind if I give you a kiss? And she gave me a hug and a kiss on the cheek. She said, I can see you're struggling with some big decisions. Oh my God. I get goosebumps telling the story. I get choked up telling the story. That's the power of compassion. It impacted my mother. It impacted me deeply. And that was 8 years ago. It's like it was yesterday. People forget what you do. They'll forget what you say, but they'll never forget how you make them feel. That's the power of compassion.
Yeah. I'll tell you what one guy told me. People will forget everything you say. They'll never forget what they eat when you're around.
Well, that's if you come from a Jewish household, and you've got some salmon and bagels and cream cheese. So that's understandable.
Actually came from an Italian guy, but yeah.
Yeah, same thing.
Sure,
Same
yeah.
thing. You got some
Spaghetti,
pasta with sauce.
pasta, or yeah.
Exactly. Life is good. I got my pasta. It's warm. It's buttery. I'm happy.
Yummy. You're making me hungry. Well, thank you.
Me too.
Thank you so much, Lee. It's been a real pleasure speaking with you, and I definitely support your call to action and your
Thank you.
commitment to change something that really needs to change from the core. Whatever
Thank
small
you.
or big changes you make, it will definitely make a difference. It doesn't matter how big it is. It doesn't matter. Like I said in the beginning, it seems like such a huge mission, but if you take it one step at a time, then it's a very
Exactly.
small mission, and it's really not so
Exactly.
overwhelming.
Yeah, it's absolutely true. It's look, you get a big sandwich, you can't hardly hold it. How do you do one bite at a time? Let's just get started. If we ever doubt that a small group of people can make a difference, just know that's the only thing that ever has. Every movement started with one person, and then two, and then 10, and then 100, and then 1,000. That's how we change everything. It's how we change racism. It's how we change sexism. It's how we change all of the disjustices in the world, is by starting with one single intention to make the world a better place. And then do something to make it happen.
And that's what we
Do
all,
something.
we all want to make the world a better place, but we all need to really take action, which is
Yep.
do something small, do something
Yep.
big, even
Yep.
if you have to put on a hospital gown, for God's sakes.
If I can do that,
I don't think I
you
could
can
do
do
it.
one kind act a day. I mean, right? I mean, come on.
I don't think I could do it. I
Well.
cannot see myself doing it. So I think it is so brave. When I don't think I can do it, it is brave.
Just look at me in that gown and go, if you can do that, I can go give $1 to that homeless person or open that door for that woman. Fair enough. Take the challenge. 7 kind acts, one a day, 7 days. You'll be shocked at how good you feel when you give water to someone to wash their feet.
So if you guys have any ideas on how you can help spread one kind action a day, bring it on. We want to hear about it. And thank you so much for joining us.
Thank you all. Thank you very much for having me. And I look forward, if we have the opportunity, I look forward to doing it again.
Thank you. So you're going to be doing something in the future. Tell us about that.
Well, we're going to be joining with a number of organizations, including the Dr. Arnold P. Gold Foundation, to stage a national Compassion Heals Challenge, where we will put out the information, all of the contact, where you go to sign up. And we're going to see if we can enroll 1 million people into the challenge. And the challenge is very simple. I've mentioned it before. One single itty bitty little kind act per day for 7 days, a total of 7 kind acts on purpose, not accidentally, on purpose. And we're going to see if we can't get 1 million people to do it. So look for that towards the end of the year. You'll see it in media and you'll see it in the news. You'll see it all over the place. But we're going to spend a week seeing if we can't engage people to take action to make the world a better place, rather than just sitting and complaining about it and doing nothing. So
we will definitely join that. Yeah, we'll definitely
Good.
call to action and that campaign, everybody.
Good.
I
Good.
wish you all a wonderful day and looking forward to hearing from you.